Teams are only as successful as each individual in the group. Coaches know that when creating an outstanding team, you need to find diverse talent. Veterans Health Administration understands that as well. That's why Veterans Health Administration implemented a Patient-Aligned Care Team, or PACT. PACT was designed to provide whole-person care for lifelong health and wellness. PACT uses a team approach that includes many healthcare experts and resources. PACT is the patient's healthcare team. The veteran is the center of the team and an active participant in making decisions.
And the VA realized that it was very applicable, very appropriate to develop this and make it very specific for the VA.
Care of each veteran is personalized to meet individual healthcare goals. The PACT team looks at all aspects of a veteran's health with the emphasis on prevention and health promotion.
Well, I think one of the biggest benefits of PACT is access. You know, it really helps to provide good access to the care team, and the veteran will be able to get their needs met by whoever is the most appropriate person to meet those needs.
The PACT team consists of many different members, including the veteran, healthcare professionals, family members, and caregivers. Members of the team may include healthcare professionals, a primary care provider, which could be a medical doctor, nurse practitioner, or a physician's assistant, a nurse who serves as the patient's care manager, a clinical associate, such as a licensed practical nurse or licensed vocational nurse, health techs, and an administrative clerk, such as the medical support assistant. Additional team members include dietitians, pharmacists, social workers, mental health practitioners, specialists, and other non-VA healthcare professionals. And of course, the veterans' family members and caregivers are also essential to a successful team.
With a team-based approach, patients have more options to get medical care to suit their needs.
I like it because I think that everybody working as a team actually knows what the problems are that you're having, and are in their own expertise are able to explain to you, what is going on, what procedures you're going to have, and so that's better quality care.
The PACT team-based approach practices coordinated care. Each member of the team has a clearly defined role and knows how to work well together. Members of the team meet frequently and discuss the best course of action for the veteran.
The veteran is the center, and all of us are basically around their care. Every individual is different, and so some patients really like to get their care from the doctor or the provider, and some patients like to get it from different approaches.
The veteran, family members, and caregivers are encouraged to ask questions and take an active role within the team. The PACT team focus is not only on the immediate health situation, but all aspects of good health, including prevention and healthy living. The team forges personal relationships and trust within the team. As a patient's health needs change, so does the team. Bringing in new team members, even non-VA healthcare professionals, is always an option. PACT is a holistic approach to a veteran's health care. The team considers all aspects of the patient's health and, most importantly, the patient's preferences and wishes when it comes to managing health. In short, PACT provides health care the way the veteran wants it. When we return, we'll learn more about the PACT team experience. Stay with us. Navy veteran Douglas DeWitt, age 67, most recently visited the VA hospital for trouble with his knee replacement. Doug wears a brace that had rubbed a sore on his skin. He tried to take care of the problem himself, but finally decided to go see the doctor at the VA. Doug's primary care doctor took one look at his problem and said he needed to see a dermatologist.
Went to the dermatologist, and they put an injection of a steroid, and it cured it. It went away. I have a beauty mark now, but that's it.
In addition to his knee issues, Doug has a number of other health conditions, including heart disease and diabetes, which means his healthcare team is quite extensive.
The idea of the PACT teamlet is that the patients and the staff get to know each other very well, and that we're able to help them more efficiently. We're much more effective with their medical care, with their communication, and it develops more of a back and forth relationships.
I know most of the patients. I greet them when they come in. I find out what their needs are.
If the patient calls and says he's sick, then the LVN will get the call and talk to the patient and see the symptoms. And if his symptoms are further need to be assessed, they would go to the RN. Then the RN will go to the provider. And we're all a big team.
I have a very excellent doctor, Dr. Lucia. She has a very good nurse practitioner. And if I ever have any question, I can call her, and they take good care of me.
Patrick Smith was drafted into the Army in 1967 as part of the infantry. While in the service, Patrick became a sign designer. Sign design eventually led to a career, including a stint with Disney. Patrick most recently came to Veterans Health Administration because he was having some shoulder and hand problems. PACT Health Management has worked well for Patrick.
I was having some problems with my shoulder and with my hands. My hands were actually cramping up on me. And after talking with Christy and then seeing Dr. Merchant, they referred me to a specialist here in the hospital at the VA. And he sent me to physical therapy where I think I did like 7 or 8 sessions, which helped a lot.
Patrick's PACT team includes his primary provider, a nurse manager, and a physical therapist. Patrick is thankful to have a great team working with him.
One of the things that the PACT team has is a daily huddle. And so before the clinic session happens, they get together and talk about who's coming in, what their needs are, what issues they need to address, so that everybody's on the same page.
The team encourages the veteran to establish health goals and use all of the resources of the team to achieve them.
All of the providers here know that they can place a consult for any of their patients that need nutrition information.
I'm the PACT pharmacist for their doctors. So when there are issues, they can either talk to a case manager and get routed to me, or they call me directly.
I work closely with doctors and nurse case managers, especially when social issues arise.
Both Doug and Patrick worked with their PACT teams to help them with their immediate health issue, but also provided the basis for ongoing wellness, prevention, and positive healthy living. In addition to face-to-face primary care provider visits, both patients took advantage of a number of other resources to help with their health needs. Veterans can schedule in-person meetings with any member of the team, speak to them on the phone, or use secure messaging on the My Healthy Vet website. They can also take advantage of health educational materials, health education classes, and research health information on My Healthy Vet at www.myhealth.va.gov. Clinical resources include preventative care, lifestyle coaching, and early detection screening. Additional health prevention information can be found at www.prevention.va.gov. My Healthy Vet provides a resource where the veteran can find a wealth of health information. This website allows the patient to create and maintain an individual web-based personal health record. It also provides a means of secure messaging to PACT team members. In addition, there are many other online resources that veterans can access through the My Healthy Vet website.
I have used myhealthyvet.com, and that, of course, has not only my personal information, but it gives me access to other information that I would need for a better and healthier lifestyle.
Veterans Health Administration, or VHA, is committed to providing the very best health experience possible. The dedicated men and women of VHA know that coordinated health care saves time and money for the patient. PACT also improves patient safety and gives the veteran a strong voice in his or her own care.
I've never felt that I was just a number.
PACT Patient Care is a true partnership between the veteran and Veterans Health Administration. It is healthcare for the 21st century, working on behalf of the veteran for lifelong health and wellness.